If you're over 60 and dealing with sciatica that keeps returning no matter how many stretches you do, the real issue may not be your disc at all. It could be a simple mineral deficiency that's weakening your connective tissue and irritating your nerves. I'm Dr. Matthew Brooks, and today I'm going to reveal a link between sciatica and one specific nutrient deficiency that most doctors never test for. What you're about to learn in the next 13 minutes could finally lead to lasting relief instead of short-term fixes. Before we get into it, I'd love to know where you're watching from today and what your age is. Drop your location and age in the comments below. It helps me create content that truly serves you. Let me begin by explaining what sciatica actually is. Sciatica involves the sciatic nerve, which is the longest and thickest nerve in your entire body. If you look at the width of your thumb, that's often about the width of this nerve where it exits the lower back and sacrum. There are 5 nerve roots that merge to form the sciatic nerve. And when there's irritation or compression affecting that nerve, we call it sciatica. Now, there are excellent stretches you can find that can relieve sciatica temporarily, and I absolutely recommend doing them. The problem is what happens later that day or the next day when the pain comes roaring right back. Today, we're going to talk about what you can do to address this at the root cause level. Here's what we know about sciatica. Roughly 90% of the time, it's related to the disc. The disc has an outer layer and an inner layer. The inside is like a jelly donut. When the outer layer becomes weakened, some of that gel can push out and place pressure on the nerve roots that form the sciatic nerve. Then you feel pain either in the buttock or radiating down the back of the leg, sometimes all the way to the foot or along the outer part of the leg. And it's not always just sharp, severe pain. It can also show up as numbness, burning, or that deep, annoying, irritating sensation that won't let you forget it's there. Now, this is where it gets really interesting. I came across a condition that fascinated me because I hadn't heard of it before, and it completely reshaped how I think about sciatica. The condition is called myelin neuropathy. That's M-Y-L-O, myelo, referring to the marrow of the spinal column, where nerves travel up and down the spine. Neuropathy means some form of nerve damage. So myelin neuropathy describes a combination problem involving the spinal column and the peripheral nerves that branch off from it. This condition can trigger all kinds of nerve issues, including burning, gnawing sensations, numbness, intense pain, and even muscle weakness because these nerves connect directly to muscles. But here's what truly grabbed my attention. Myelin neuropathy is most commonly caused by a copper deficiency. It can also be tied to vitamin E or folate deficiency, but the majority of cases point back to copper deficiency. So I started digging into copper in relation to the sciatic nerve, and what I found was genuinely fascinating and could change how we approach sciatica. First, there are many therapies that use copper for inflammation and pain. Copper bracelets, copper patches, copper creams, and even braces that wrap around the upper hip area near where the sciatic nerve begins, infused with copper. A lot of people report surprisingly strong results with these copper-based products. We don't fully understand why topical copper may reduce pain and inflammation. Maybe small amounts are absorbed through the skin, but copper is also highly conductive, so it may be influencing electrical fields that are out of balance around the painful area. There isn't much research here, but that doesn't mean it can't work. The number of people reporting meaningful relief from copper products is very large. And I'm talking about skeptical people. I'm not going to wait for perfect studies before considering something that's low risk, non-toxic, and relatively inexpensive for someone to try. Even going back to ancient Egyptian times, copper bracelets and copper jewelry were used for pain, inflammation, and arthritis. Interestingly, the Arthritis Foundation says there's no validity to copper or magnetic bracelets. But over the years, I've learned that when certain organizations strongly discourage something, it sometimes works extremely well. And you have to pay attention to who is funding those organizations. Now that's copper used externally. But what about copper deficiency inside the body? What does that have to do with sciatica? It's connected to a lot. Copper is required for several key enzymes in the body. One of the most important copper-dependent enzymes is essential for building collagen and connective tissue. And here's the key point. Your disc is largely made of collagen. About 75% of the outer layer of the disc is collagen. So if you're low in copper, and therefore struggling to produce adequate collagen, you can develop weakness in the disc structure itself. That weakness makes the disc more likely to bulge or herniate and press on the sciatic nerve. Copper is also involved in enzymes that support nerves, the nervous system, nerve transmission, and even myelin, which is the protective coating around nerves. When you look at copper deficiency through this lens, a lot of sciatica-related pieces start fitting together. Some people also develop carpal tunnel syndrome when copper is low. So copper matters for collagen and connective tissue. I've done videos about collagen before, including how important vitamin C is for collagen production. But if you look at nature, copper is part of the vitamin C complex. They function together. You have copper supporting collagen and connective tissue. You also have copper supporting the nervous system. Certain parts of the brain contain very high copper levels, especially regions connected to dopamine. This is why copper deficiency is often seen in people with Parkinson's disease, which involves dopamine pathways. Dopamine is essential for the nerve-muscle connection. Copper also plays roles in energy production, sleep support, melanin production, which relates to hair graying, red blood cell formation, bone building, and antioxidant protection. As you can see, copper does a lot throughout the body. So, how does someone become deficient in copper? There are many reasons. First, simply not consuming enough copper in the diet. Copper is especially high in shellfish and organ meats, two foods most people don't eat regularly. Athletes are often low in copper because heavy physical activity raises copper demand, especially at higher altitudes since that strains red blood cells. If someone trains hard and doesn't eat properly, they can become copper deficient and develop weakness in connective tissue, collagen, tendons, ligaments, muscles, and discs. Taking high amounts of zinc without balancing it with copper can drive copper deficiency. Taking a lot of iron can also deplete copper. Enriched flour products like bread and pasta can reduce copper levels. Fluoride from tap water can definitely lower copper. Too much vitamin C, mainly in the form of ascorbic acid supplements, can deplete copper. If someone is taking 2, 3, or 4 grams of ascorbic acid daily, that can drain copper. Heavy sweating can lower copper because copper can be lost through sweat. Too much sun exposure can reduce copper because of copper's role in melanin. Stress and elevated cortisol can deplete copper. Even taking too much potassium without trace minerals like copper can deepen the deficiency. Distilled water can contribute to mineral deficiencies across the board, including copper, unless minerals are added back in. High levels of niacin can reduce copper to some degree. Gastric bypass surgery frequently leads to copper and other trace mineral deficiencies. Eating too much sugar, drinking excessive coffee or alcohol, and using artificial sweeteners like aspartame can all deplete copper. But I think there's one more factor that's especially important. Some people with sciatica may have a genetic issue affecting copper absorption, creating deficiency even when their intake looks normal. This is related to DNA polymorphisms, meaning variations or errors in genes that can leave you prone to low levels of certain nutrients. I found 2 specific genes where problems are strongly associated with copper deficiency. Studies link this to higher risk of carpal tunnel syndrome and compression fractures because copper supports bone formation. And part of bone structure relies on collagen. All of this is fascinating, but what can you actually do about it? You have 3 practical options. Option number 1 is trying a copper brace. Search online for copper braces made for sciatica. These braces look like hip supports, but they wrap around the area where the sciatic nerve exits near the upper thigh, and they're lined with copper. This may provide temporary relief. There are also copper patches and copper creams that many people say are helpful. Option number 2 is making sure you're getting enough copper through food. The richest food sources of copper include beef liver or liver in general, oysters, shellfish, dark chocolate without sugar, cashews, and grass-fed beef. These are strong natural ways to raise copper intake through diet. Option number 3 is copper supplementation. This matters because you can actually correct a deficiency. And if you happen to have a genetic weakness that reduces copper absorption, you may need more than a minimal amount. Here's what I recommend. Begin with 2 millimoles of copper per day and slowly increase over the course of 1 month to 20 millimoles. Increase gradually every few days, adding a bit more until you reach 20 millimoles. You may need those higher levels to create the change required for your disc to start repairing and your nervous system to begin rebuilding. After 1 month at 20 millimoles, you can test lowering the dose and see how you feel. If you do well, remain at a lower level. If symptoms worsen, increase slightly. Over about 3 or 4 months, attempt tapering down to around 2 millidollars per day and see if that works for maintenance. The goal is to supply enough copper for your body to rebuild disc collagen and repair nerve damage. Then you identify the maintenance dose that keeps you feeling stable. Now I want to clarify something important. This copper connection does not replace the need for sciatica stretches. You should still do stretches to reduce immediate pressure and preserve flexibility. But if you don't address an underlying copper deficiency, you're mainly managing symptoms temporarily instead of correcting the core issue. Stretches give you relief today. Copper supports healing for tomorrow and helps prevent the problem from returning. Let me explain why this is especially important after 60. As we age, nutrient absorption drops. The digestive system produces less stomach acid, which is needed to absorb minerals like copper. Many seniors take medications that further interfere with mineral absorption. We're also more likely to be depleted after decades of stress, poor diet, and medication use. And we're more likely to have age-related disc degeneration, which makes copper deficiency even more damaging because copper is needed to maintain the collagen structure that remains in those discs. Think of it like this. If your disc is like a tire and the outer layer is weakening because collagen is insufficient, stretching alone will not rebuild that tire. You have to restore the structure. Copper helps do that by supporting collagen production. At the same time, if nerves are weakened by copper deficiency, they become more sensitive and more likely to generate pain signals, even with minor compression. Copper can support nerve repair and strengthen the myelin coating that protects nerves. This is why this connection excites me. It's not just about momentary pain control, it's about healing what's underneath. I've seen patients who suffered with sciatica for years trying every stretch, every therapy, every medication, and nothing produced lasting relief. Then they addressed copper deficiency, and within weeks to months, their sciatica improved dramatically, or even disappeared completely. Their discs finally had the building materials they needed to repair. One more point I want to add. If you decide to supplement copper, make sure you're also supporting other minerals, especially zinc, because mineral balance matters. A high-quality multi-mineral supplement can help, or you can take copper and zinc together in appropriate ratios. For maintenance, the ratio is often about 1 part copper to 10 parts zinc. But while correcting deficiency, you may temporarily need higher copper, as I outlined. Also, pay attention to how you feel as you increase copper. Some people may notice mild digestive discomfort if they raise the dose too fast. That's why I recommend gradual increases. If anything feels unusual, reduce the dose and increase more slowly. And of course, if you have medical conditions or take medications, speak with your healthcare provider before starting copper supplementation, especially at higher doses. Here's your action plan. First, assess your copper deficiency risk. Are you eating liver, shellfish, or other copper-rich foods regularly? Are you taking high doses of zinc, iron, or vitamin C that could be lowering copper? Do you have any of the risk factors I mentioned? Second, consider trying a copper brace or patch for immediate relief while you work on the internal deficiency. Third, add more copper-rich foods to your diet. Fourth, consider copper supplementation starting at 2 milligrams and building up to 20 milligrams over 1 month, exactly as I described. Fifth, keep doing your sciatica stretches while you address the nutritional component. And sixth, give it time. Collagen rebuilding and nerve repair do not happen overnight. You need several weeks to a few months to see the full effect. If you found this helpful, please give this video a thumbs up and share it with someone over 60 who's struggling with sciatica. Subscribe to Dr. Matthew Brooks for more evidence-based health tips designed specifically for those over 60. Have you tried copper for sciatica or nerve pain? Drop a comment below. I rid everyone and I love hearing about your experiences. Until next time, stay active, stay informed, and remember your health is your greatest wealth. This is Dr. Matthew Brooks signing off. Sometimes the answer to chronic pain isn't another stretch or another pill. Sometimes it's a simple nutrient your body has been missing for a long time.